Hi. When is it okay to cry on hospice? Well, I think we all know and agree that crying is a good thing. It clears the soul, and whether it's from beauty or whether it's from pain or suffering. There are different kinds of crying. There's the kind of crying that your eyes just become moist and it just makes you look attractive. And then there's the full-on crying, eyes red, face blotchy, snot coming out. And I think that that's one that makes us feel quite a bit more vulnerable. I think it makes us vulnerable in general. Um, so my daughter once said to me, "Mom, I never saw you cry until I was 18 years old, and now you haven't stopped." And she was right. And I think that comes from a place as when I was younger, I was a bit more bottled up, less willing to be vulnerable. And as I've gotten older, I lean more into crying, whether it comes from pain or joy. Um, and But I want to talk about a hospice and crying on hospice. Most seasoned hospice nurses are very comfortable sitting in the presence of pain and suffering and loss and of really high emotion, the kind that really bubbles up. And I have to say, I think that when I'm witnessing somebody coming to terms and grappling with facing their end of life, or a family in the grips of grief, I feel that emotion rise up in me, witnessing that there's even a beauty in it, and I can feel that emotion come up in me, and my eyes will tear up, and that can be a beautiful source of connection. Um, uh, I once had a really wise teacher say to me, "For a hospice nurse, it's okay to cry with your patients as long as you're not the first and you're not the loudest." And I always found it to be good advice. As a hospice nurse, um, and I feel some emotion really welling up in me, and feeling like it's about me, and I feel a little out of control, I just say, I'm going to step away for a moment. And an example of that was years ago in one of my really challenging, long, complicated pediatric cases, and the family was just in the, the throes of grief when this child died. And I stepped out into my car, and I had a good, hard cry. Pulled myself together because this wasn't my child. This family needed me to give guidance and be the grown-up in the room. And a family or patient should never have to feel the need to comfort somebody on the hospice team. There should never be that feeling. As I said earlier, we do feel vulnerable when we cry, and I encourage people to say, or say, "Can I just please have a moment?" If they're feeling vulnerable and they don't want to cry in front of somebody, just say, "Can you just give me a moment?" But some people find that uncomfortable to actually ask that. So when I'm feeling that emotion rising up, and they're becoming vulnerable, I give them a real clear choice. I say, "Would you like me to stay, or would you like a moment alone?" And that's easier. It gives them permission to say yes or no, or and uh, but it says it's okay. I never ask, "Are you okay?" They're not in that moment, and that is okay to not be okay. So I tend to avoid that question. I sometimes offer a sense of permission, like, "This is good. Tears do cleanse the soul," and honestly, crying is the most raw form of love that we can express, really. And that frees people up to feel normal and healthy. Um, Very often, I say nothing. I just sit in that presence, and this takes some time and experience. Um, so whether you're a hospice provider or a patient or a family, I hope that you found this helpful and validating. And you can find out more about end-of-life care, and you can get a copy of our care plan, the Hospice um, Care Plan booklet, on our website, thehospicecareplan.com, or you can find one of our many videos on our YouTube channel, The Hospice Care Plan. Thank you.